Or respiratory syncytial virus, a common seasonal illness that often sparks panic in parents. Doctors say many of the symptoms can be treated at home safely and effectively, but knowing when to seek medical attention is critical.
It's definitely unprecedented, which is the common word for what we're seeing right now.
Parents are rushing their sick kids to the emergency room at Rush University Medical Center.
We're seeing kids come in quite frequently, in and out. We're treating them as quickly and as best we can in the emergency rooms and hopefully preventing admissions. It's like real life.
Rush respiratory therapist Ann Geistkemper uses a medical mannequin to teach signs and symptoms of RSV.
So very common things to start with are going to be your fever and increased respiratory rate.
Over-the-counter medications like Motrin or Tylenol help. So does a simple suction tool.
Another sign or symptom would be increased congestion, so they get a ton of boogers.
But there are more severe symptoms to watch out for in 3 key areas.
You might see fast breathing, which is something that you can visually count. You also might see some retraction. So you might see them working a little bit harder in their neck, starting to work a little bit hard in their rib area. Those rib muscles are starting to work. And then you might even see some belly breathing.
All signs the child is compensating for how hard it is to breathe naturally.
Those would be some signs where you'd be really starting to get concerned and you'd want to contact your doctor and see if they need further care.
There are other red flags. Watch for lethargy and skin tone changes.
So if you were to see any sort of discoloration in your child's skin tone that is just different, then that would be considered a medical emergency. So that can be caused from lack of oxygen, which might be due to how hard they're working to breathe and what they're trying to fight, and that can change the skin tone throughout their body.
Rush pediatric hospitalist Dr. Laura Meltzer says unlike the common cold, RSV symptoms worsen over the course of several days.
While a common cold may last 2 or 3 days, with RSV, sometimes the symptoms are actually worsening on that 3rd, 4th, or 5th day, which definitely prompts parents to think, is there something else going on? Is there something else I should be doing? So that's why I think if the symptoms are mild, a call to the pediatrician would be helpful. But if any of these concerning breathing patterns, alertness, hydration concerns are occurring, then bringing them in for emergency care.
And hydration is critical. Keep the fluids flowing. If you notice your child hasn't had a wet diaper or any urine output in 8 hours, reach out to your pediatrician to schedule a virtual visit if possible. And trust your gut. You know your baby best.